In terms of the results, the first thing that struck me was the positive results. The fact that the majority of patients have confidence in the clinicians and the hospital staff that treat them, which is so important. And the majority of patients, 83%, felt that they were treated with dignity and respect. And again, that's so important in any aspect of your life, but particularly when you're in hospital and when you're vulnerable, you're not well. So I was really pleased to see that. The other finding that struck me, and again, really pleased to see it, was the 96% response from patients who felt that their hospital ward or their hospital room was clean. In terms of some of the areas that need to be improved, and again, wearing the hat that I wear representing carers and families, there's really 3 areas that I was struck by. The first one was, the fact that so many patients are, having a significant delay in the emergency department. 70% of patients weren't seen within the 6-hour target. So I feel myself that, if your journey into the hospital is negative, it's very hard to recover from that later in the patient's journey. The other thing that struck me was the fact that so many patients felt that neither they nor their family members were involved in decisions relating to their care and treatment. And it's so important that the patients involved in decisions relating to their care for obvious reasons, but equally so, it's important for family members to be involved, particularly if they're going to be significant carers post-discharge. And then the final thing that struck me is the issues with discharge and the fact that 40% of patients reported a poor experience with discharge. I think the positives from that are that those issues seem to be caused by information deficits, which could be easily rectified with practical guides and supports for patients and their families. So Family Carers Ireland have offered our support to the hospital groups and to individual hospitals that, we'd be delighted to work with them to offer rights and entitlements support to families and carers who find themselves in significant caring roles post-discharge. And for example, one of the things that was shown in the survey is that there's a real information deficit, or appears to be an information deficit post-discharge, where families don't have information relating to the care of their loved one. So we would be happy for our free phone number to be included on the discharge letters of hospitals, so that families could contact us with any questions they may have, or just a listening ear from people who understand the real challenges of caring for a loved one. Well, I'd really just restate the importance of including families and carers in any effort to improve the patient experience. We know we have a national report, a national carers strategy, and the vision of that is to respect carers as expert partners in care. So it's really important that we do listen to the voice of carers and families where patient permission is given, and also where someone is undertaking significant care for their loved one, that their needs are assessed and addressed in their own right. I absolutely, and again, I finish where I started, saying that, with a response rate of 51%, it shows the desire of patients to have their voices heard. Again, the Taoiseach, when he spoke today, mentioned that this really is the beginning. We've established the baseline, and the challenge for the hospital staff and hospital groups, and indeed people like myself who work in related sectors, is to make sure that we can improve those patient scores in the years ahead.